Traveling with any chronic illness can be challenging. Packing is way beyond making sure you have enough clean underwear for the trip. You have to be prepared for anything. When you book a hotel, be sure to ask a lot of questions, especially about accessibility. Is it on the first floor? If not, do they have an elevator? If you use a wheelchair, do they have any accessible rooms? What is the bathroom setup? Does it have a roll-in shower with a bench? If not, do they have a bathroom that has a shower bench or a chair? If you take medications, be sure to either lock them in your room safe or in your car, either in the trunk or someplace else out of sight, so those medications are not falling into the wrong hands. If they are available, ask for a room with a microwave and a refrigerator. Having those two things makes things a lot easier and potentially cheaper. If you're on a special diet, I highly recommend packing your own food that you know is safe. It can go in an ice chest or a soft side cooler, like one of the ones shown here, if it needs refrigeration during your travel. That not only allows you to have safe food, but it saves money from not having to go out to eat at restaurants or delivery, and it's ready for you in your room. You don't have to go out and get food when you're tired, in pain, don't want to leave your room. I also make sure that I pack plenty of Gatorade to help manage my dysautonomia issues. If you are traveling to one of the larger hospitals, like Stanford, if you're traveling for medical reasons, ask if they offer a hospital patient reduced rate. Not all hotels near the larger hospitals do this, but a lot of them do. And now for packing. Like everyone who travels, you'll need to pack clothes and toiletries. If you have a chronic illness, you need to pack more than most. For example, I have a hard time regulating my own body temperature. That means I have to pack for being too hot and for being too cold. If I am having some sort of procedure done, I need to make sure that I pack clothes I can wear afterwards with any restrictions I might have. If I'm going to have a hard time putting my arms above my head, for example, I need to wear a button-up shirt or something that's really loose and stretchy. I also need to make sure that the clothes that I'm packing are comfortable to wear while traveling. Traveling is uncomfortable enough as it is. I don't need to make it worse. I also need to make sure I pack at least one extra change of clothes per day that I'm going to be gone. For example, so if I'm going to be gone 4 days, I need to pack 8 changes of clothes instead of just 4. With my feeding tube, I frequently have to change my clothes if something leaks or if my tube clogs while I'm putting my medication slurry through it and it sprays out, which happens a lot. With my feeding tube, it just makes everything messier. So I have to plan accordingly. I can't handle fragrances and I have very sensitive skin. So I can't just use the shampoo and conditioner and stuff that the hotel provides, rather. And even that the hospital provides, I have issues with some of that stuff. Quite a bit of it, actually. So instead, I have plastic travel bottles with all of that stuff that I have clearly labeled that I bring, along with any cosmetics that I may want to use. I always make sure that I pack plenty of hair ties and clips so I can get my hair up and contained if I need to, either for comfort or for a procedure or test. Be sure if you have metal clips in your hair and you're going in for a procedure or a test, make sure that they know that you have metal in your hair, because sometimes that can cause issues with equipment being used or interfere with test results. I found that putting my hair up in a high bun, like shown in this photo, when going in for surgeries or if I'm requiring the use of some sort of respiratory equipment like the BiPAP mask shown here, it makes keeping my hair neat and contained and untangled to get things on and off a lot easier. Okay, the travel itself. Riding in a car can be painful to anyone, but especially those with chronic illnesses. My mom's Subaru Outback's front seats recline almost all the way flat, which really helps with pain, especially my CSF leak positional migraine. The seat itself does not offer very good lumbar support or good SI joint support. To fix that, I use either a lumbar pillow for my lower back, and then I sit on either a memory foam pillow that is backwards, like in this photo, that helps take some of the stress off the SI joint, or I use this, which is specifically for that. It's a special pad made for better support and less stress on the pelvis, lower back, and SI joint. And it can be used just about anywhere. I even put it on top of my wheelchair seat, and it helps with the pain and fatigue even from just sitting in my wheelchair for however long I'm in it. A travel neck pillow like the one shown, or a soft collar or hard cervical collar are also really good to bring. Falling asleep on the drive without something supporting your neck and your head can cause a lot of pain and potential damage. I also find it helps during a lot of the start and stop traffic that can be really jarring for your neck. If I sleep during the drive, my ventilator has a battery backup so I can use it in the car. Because of the chronic migraine I deal with my CSF leaks, light sensitivity can be an issue while driving in a car. For that, I either wear my prescription sunglasses or I wear this blackout eye sleep mask. Obviously, I can't wear it with my glasses on, but I just take them off and put the mask on, and it works pretty well. My mom and I have also discovered that listening to audiobooks during long drives really helps with the stress of traffic and makes the drive seem not quite so long and miserable. Okay, the bed situation. Sleeping comfortably is often hard to do at home with all your comforts. Strip away those comforts and you get your typical hotel bed. At home, I sleep in a hospital bed and have for about 10 years now. I have it for a lot of reasons, most of which are Ehlers-Danlos syndrome related in some way, like dysautonomia, needing to adjust support and positioning easier for joint injuries and pain, GERD, sleep apnea, my respiratory illnesses, lung damage, etc. I am also tube fed at night, so I have to be reclined 30 degrees or more. Obviously, my hotel is not going to have a hospital bed for me to use, so I have to get a little creative. I always pack a wedge pillow and bring most of the pillows off my bed. It helps give me a good base to build on to make a recline at the head of the hotel bed. Once I have the head of the bed finished, I put 2 or more pillows under my knees and any extra pillows around for supporting things for a little extra comfort. Once I've got everything on there, it's usually fairly comfortable. Okay, medical related packing. Just like with clothes, I need to pack more than enough for every day I'm gone on a trip. Especially with hospital trips, we never know if something is going to go wrong or if I'm going to have to stay longer for some reason. Unless I am anticipating the possibility of having to stay longer, I usually pack 3 or more days extra of everything. I have severe gastroparesis and have a DJ tube. I'm tube fed every day, and that also is how I get most of my medications. Here, I am packing 3 days of my feeding rigs and 3 days of medication syringes. And here is 4 days worth of formula. I'm also packing some chucks. They are very handy when trying to keep formula and medication slurries from getting everywhere, and afterwards I just have to throw them in the trash. So like I said, that was four days of formula. We just pack it, box and all. I have a GJ button tube, so that means I have extensions that have to get attached to it. Those extensions are to be changed every week, and they have the possibility of breaking. Because of that, I always pack at least 3 or more of the G and the J extensions. That includes the current tube that I'm using. I also use AMT clamps to hold my tube extension and feed line connected during my feeds at night. They can snap without warning, so I pack 2 of those. My feed pump comes off easily off the IV pole, and the IV pole itself collapses down, kind of like a camera tripod does for easy travel. If I'm having some sort of procedure done, I also like to pack Cavalon. Cavalon is a skin barrier used for lots of things, including being a skin prep for adhesive bandages, which is like those transparent dressings when I have my port accessed, and those tegaderms. That helps protect the skin from the adhesive, and it helps lessen the damage to my skin because of my allergy to the adhesive. I also usually have a couple packs of Cavalon swabs in my purse, just in case. If my port is going to be accessed, then I try to pack a box of, or if I'm anticipating a bandage, I try to pack a box of my IV 3000 transparent bandages, as I find that they are significantly easier on my skin. In my purse, I must always have a roll or 2 of high tape, aka the pink tape, in case I need it for anything, since even a basic band-aid can cause a chemical burn. High tape is the only medical adhesive I have found that seems to be okay on my skin. Some hospitals and facilities carry these, but not all of them. And sometimes they either don't have it in stock or they don't know where to go find it. It can make things a lot easier just to have it already. I use this blue portfolio to organize medical documents that I need or might need. I include visit summaries from appointments with my specialist, copies of tests, all the literature for my feeding tube and power port, a couple copies of my medical info packet, discharge summaries, and any other medical documents I might need, and a notebook. You can find a template for the medical packet I carry with me and give to all my medical providers on the Life of a Human Zebra blog on Facebook. They love having all my complicated health stuff broken down, easy to read, even in emergencies. My nurses frequently thank me for making it. I also keep a note on my phone of any questions or concerns that I might have that need to be brought up during an appointment or a procedure. Handling putting medications through a tube while traveling can be difficult. If I'm going to be gone all day, or if I'm going to still be on the road when my meds are due, especially the midday meds, I crush them ahead of time and I put them in a bottle or a jar with a screw cap lid that seals well. I use a bottle or a jar that I can easily get my big 60 ml syringe into to draw up the meds. I pour water and be sure that you actually pack bottles of water, and don't do what my mom has done in the past and put them in the ice chest. It's a little chilly. So I pour the water into the jar and into the liquid meds, put the cap on, shake it. I'll use a plastic cup, or any cup is really fine that I can draw water up out of, fill the extension, and this is just kind of the normal routine for my med stuff. And then afterwards, when I go to attach it, I put down either a towel or a chuck or both, to try to catch any spills if I'm doing this in the car. And then, like I was saying, same routine as at home. Afterwards, my syringes do come with caps, so if I haven't lost the cap, I'll put the cap back on it, dry everything off, and put it back in the bag. I always pack several towels. I even use them in the hotel rather. The hotel towels in most hotels are white. A lot of my medications can stain really badly, so I want to be courteous and just use my own towels. So here is my med setup bag. I have all the items I mentioned earlier: syringes, cups, jars for med solutions, the G&J extensions, AMT clamps, etc. I make sure that I pack high tape, alcohol pads for my Relistor injections, the Q-tips and gauze pads used to dress my stoma. I have a travel-sized bottle of hydrogen peroxide, which I use to clean my stoma, and whatever measuring tools I need for my liquid meds. In addition to packing my liquid medications, I pack at least 1 can of Coke, and that is the actual brand name Coke, for any potential tube clogs. It's crazy that works, but it works better than anything. I also make sure that I bring a pair of medical shears that can easily clip off the tip of my med syringes, and can easily cut through multiple gauze pads. I pack an assortment of over-the-counter medications that I may need, or that whoever I'm traveling with may need. But that is especially true for Benadryl and Zantac for any potential mast cell reactions. Lastly, I pack my stainless steel mortar and pestle. I use the small towels that I bring to wrap up the cups, jars, and mortar and pestle, and use the towels to hold everything together in place in the bag while traveling. Before traveling, I organize my meds into these bags for each day. I put all the morning meds, midday meds, and night meds in snack-sized individual Ziploc bags, and then put each complete day's little baggies inside a quart-size Ziploc bag for each individual day. I pack all of my meds in addition, just in case. My wheelchair always gets packed, as does my Trilogy ventilator. Like I mentioned earlier, it does have a battery backup and can easily travel. I use my laptop as a big coping tool. I always pack my laptop, even if I'm not planning on being gone overnight. I never know when something is going to come up. I use my computer and my phone as a communication tool when I'm dealing with my lung issues and can't really talk. It's also a great distraction when I'm in pain or the anxiety gets really bad. I have a small surge protector that I carry with my laptop, and I always pack an extension cord. I have multiple machines I use at night that require being plugged in. A couple of them do have batteries, but that's not going to last the whole night. Every hotel room is set up a little bit differently when it comes to power outlets, and almost always I have to use an extension cord. That cord is super helpful if I need to have easy access to a plug when I'm in a hospital room too, allowing me to keep my cell phone and computer plugged in. My nurses always laugh when I'm in the hospital and they plug everything in for me and they're like, "Wow, you sure are prepared." I'm like, "Yeah, it's not my first rodeo." If I'm going on a vacation, Then I also need to pack for anything I may be dealing with at my destination. For example, if I'm going to the coast, I need to make sure that I pack sunscreen and sandals that I can easily and safely walk around in. I also need to look up what emergency medical services are available nearby, just in case something comes up. It wouldn't be the first time I've ended up in the hospital on vacation. If I'm traveling with my service dog, Forrest, then of course I also need to pack dog food, dishes for food and water, his cape, leash, boots, and potty bags. Usually with his food, I just put each day's worth of food in individual Ziploc bags, kind of like I do my meds. That way I don't have to handle large bags of food that are also pretty messy to travel with, and all I have to do is just open the Ziploc and just dump it in his bowl. Ultimately, it comes down to the Boy Scout motto: be prepared. I try to be prepared for any eventuality, especially since my health issues can be a bit unpredictable. Planning and preparation helps make my life easier and safer. That pretty much sums up how I deal with travel. For more information on Ehlers-Danlos syndrome and other chronic illnesses like gastroparesis, check out The Life of a Human Zebra. It's a blog on Facebook at facebook.com/The Life of a Human Zebra. Click subscribe below and check out the other videos on my channel. Hope to see you soon.